Ovarian cancer is the second most common gynecological cancer, and it's the leading cause of death from cancer in women in the United States. But the problem with ovarian cancer is that there is no screening available. There are a lot of blood tests that has been suggested over the years, and ultrasound, pelvic examinations, but none of them has shown that any improvement in survival.
What are the things that some women may actually notice and think ovarian cancer?
We can talk about ovarian cancer symptom index. And these are the patients that they've experiencing abdominal pain, pelvic pain, early satiety, they just don't want to eat as much. You know, any of those symptoms that patients have been experiencing for less than 12 months, those are warning symptoms and they need to see a gynecologist. And, you know, when they see us, we'll order vaginal ultrasound and pelvic examination.
Okay, now you've been diagnosed with ovarian cancer. You have it, you've been told, you're scared to death. What's next? What do you do?
Surgery is the mainstay for ovarian cancer, and it's usually cytoreductive, which means that taking the uterus, cervix, ovaries, tubes, peritoneum, and a lot of abdominal fat that we have in the upper abdomen, those will take out. And after you take all the tumor residual from all over the abdomen, then chemotherapy is a standard care.
What information can you give women so they don't feel helpless? What can you give them? What kind of take-home information that all women should know about ovarian cancer, so hopefully they don't end up getting it?
Fortunately, there are things we can do to prevent ovarian cancer from happening. Number one, get pregnant, breastfeed, use oral contraceptives. We know, and if you use over 6 years, your chances reduced by 30 to 40%. That's a huge number. Now, of course, if talking about family history, you can't do anything about it, but you can do things to reduce your risk. If you have family history of ovarian cancer or breast ovarian cancer, if you have family members that they've got these two cancers, very young age, or you have multiple family members that they suffer from this disease in early age, this is when you need to see a gynecologist and get genetic testing. Now, all the guidelines agree that if the patient belongs to a high-risk group, they need to see a gynecologist every 6 months. They need to have a pelvic examination, ultrasound, and blood tests.